October is Breast Cancer Awareness Month, and there's actually some good news. There's a new report that breast cancer death rates have dropped almost 40%. Here with more is Dr. Richard Chaffoo. Doctor, good morning.
Good morning,
is good
Shally.
news.
It's very good news.
Okay, when was this study done? I think I heard this a few weeks ago. When was this study exactly done?
So you're right. It came out just a few weeks ago, Shally. And what was fascinating is, we looked at the incidence of cancer death rates that occurred. Actually, it started to go up. And then if we looked at that period in the past 25 years, we've actually seen a gradual decrease to really a 40% drop in the incidence of breast cancer deaths. So it's been remarkable.
Yep, 40% is
It's
a
huge.
big drop.
It is
Dr.
a big
Chaffoo,
drop.
why the drop?
Well, it's a great question. There's really two reasons, Shally. Number one is, better detection and screening, better mammography. The word's getting out that people should get mammography. Any cancer, detecting it early is the best way you're going to cure it. And then secondly, there are wonderful drugs that researchers have developed over the past several decades. We know there's tamoxifen, there's Herceptin, there's other aromatase inhibitors that are all targeted at reducing recurrence rates. And there are new immunotherapy that's being developed. So there's really exciting technology that is helping to battle breast cancer, which, as we know, is the leading cause of cancer in women in the United States.
I had my first mammogram done a few months ago, and when I was talking to the nurses and the technicians, they were saying that they hoped that more women would come in and do this earlier. That's the big key, is to be one step ahead.
Absolutely, that's a great point, Shally. We can't emphasize that enough, is that it's all about early detection and following the guidelines of the American Cancer Society. At the age of 45, women should be getting mammography yearly, and after the age of 55, every other year. And that's, of course, in low risk in the general population. Of course, women that have got first-degree relatives with breast cancer will have other indications for earlier mammography. So it's really important to keep up on those regulations and watch that closely.
Okay, I know women are going to want to hear these next two things because a lot of us color our hair. There's a new study that says frequently dyeing and coloring your hair has been linked to an increased risk of developing breast cancer. Is that true?
Well, we want to be cautious about an individual anecdotal study. It's done by a London surgeon, and he actually saw what he saw was a 14% increase in incidence of breast cancer in his patient population, women that dyed their hair. But researchers caution us because, number one, it's one small study, needs to be repeated, and secondly, there's no real cause and effect relationship, but it does begin the discussion about, are there chemicals that we need to be careful with? And so his study, interestingly, said, well, maybe recommending more natural products using henna, rosehip, beetroot versus some of these chemicals, these caustic agents. It's interesting, but not yet a causal effect relationship.
Okay, but they have proven, correct me if I'm wrong, breastfeeding actually reduces the risk.
So you're right. The researchers have found evidence that women that breastfeed have a reduced incidence of breast cancer, 20 to 25%, and that's significant. Now, it's probably thought, researchers are telling us, that it's due to the fact that there is a change in the parenchyma of the breast that occurs with breastfeeding. We know that the younger a woman is when she begins to breastfeed, the longer she breastfeeds and the more children that she breastfeeds seems to have a slightly lower incidence of breast cancer. And so there may be a protective effect. We know we do know that breastfeeding is important for the mother-child bonding and also for, protective effects, but this is the first evidence that there may indeed be a relationship between breastfeeding and the development of breast cancer.
So Dr. Chaffoo, it's important to talk about these things. One of my very good friends, his sister just passed away from breast cancer. So sometimes it takes that reminder. It's what got me to go and do my mammogram. So maybe this is a reminder to any of the women who are watching right now to just make an appointment and go check yourself out. Dr. Chaffoo, always good to see you.
Good to see you too, Shally.
7:45, let's get you outside of Raul.